Okay, hello everyone. Thank you for attending this webinar today. It is called Scaling Up Community Involvement in Harm Reduction, Policy and Practice. And it is developed as part of the BOOST project that was spearheaded by the Correlation Network and also the Eurasian Harm Reduction Association, and is wrapping up this year. During this webinar, we will tell you about the new policy brief of EuroNPUD that is called Where There is Fruit, There is Seed. And also we will foster a dialogue on scaling up community-led harm reduction across Europe. Key presentations will focus on introducing actionable policy recommendations for community involvement in harm reduction. Also, the webinar will feature speakers from our network, from the Eurasian Harm Reduction Association, from Mantes la Gallette, from APDES and Young Wave. And this webinar aims to inspire commitments to fund, formalize, and strengthen community roles in harm reduction. And without how do they say it in English? I forgot, sorry.
Further ado.
Yes, exactly. Thank you very much. I would like to give the floor to Vielta Parkomenko from Ukraine. Vielta, please, would you like to share some opening remarks with us and steer us forward? Thank you.
Hello everyone. My name is Vielta Parkomenko, and thank you, Alexei, for introducing me. Today I'm representing an international network of people who use drugs, and I will moderate our great event. And I'm honored to moderate today's webinar, Where There is Fruit, There is Seed, held as part of the BOOST project. Today we are marking the launch of an important policy brief developed by EuroNPUD, a timely and evidence-based call to action that places the leadership of people who use drugs at the heart of harm reduction systems. This document goes beyond consultation. It advocates for structured, funded, and sustained community involvement, not as an afterthought, but as a central pillar of health and drug policy. Throughout the next 90 minutes, we'll hear from community-led organizations across Europe, from France, the Czech Republic, Lithuania, and Portugal, as well as donors and partners who are supporting this shift. And to set the stage, we'll begin with Igor from Eurasian Harm Reduction Association, who will present the framework of the BOOST project and share the broader context of this event. So Igor, please go ahead. Your floor.
Yeah, thank you, Vielta, for this introduction. So good afternoon. Can you see the slide properly? Yes?
Yes.
Yeah.
Great. So good afternoon from my side and greetings from Nice, as we discussed today. The weather is good. And my name is Igor Gordon, and I represent the Eurasian Harm Reduction Association based in Lithuania. And so, but I moved to France about a year and a half ago. And while I'm still very much learning French, as I said today, and finding my way here, I'm proud to continue working in this European space where we all share the same commitment and to harm reduction and community empowerment. And today I'll briefly take you through how the BOOST project came together, how we identified our joint priority, especially community involvement, what we discussed today, and how this process resulted in the policy briefs that are now guided our community advocacy work. So the BOOST stands for Building Capacities for Community-Led Health and Harm Reduction in Europe. It is an EU-funded initiative coordinated by Correlation, European Harm Reduction Network, together with the partners including EHRA and EuroNPUD. Unfortunately, this project ending this year, but still the results and outcomes and our cooperation will remain, I hope. So very much. And our shared goal is to strengthen community-based and community-led organizations and to make them a recognized and sustainable part of the public health systems. And so the itself boost works through four interlinked components. And here they are: inform, improve, support, connect, and act. And the last one, connect and act, is what we call work package 5, and that's the part led by EHRA. And this work package 5 focuses on strengthening and consolidating the European harm reduction networks and community networks. And it has three key aims. First, to improve cooperation and advocacy at the European level, helping our networks speak with a one voice. Second, to support community-based advocacy at regional and national and local level through mentorship and small grants. And third, to translate evidence into a policy by developing policy briefs and facilitating dialogue with the decision makers. And so, to build these connections, we started by listening. Each network organized its own online dialogue back in 2023. And so more than 100 participants from over 20 countries joined and shared their thoughts. What we asked? We asked, what are the biggest barriers for people who use drugs in accessing harm reduction? What's working and where do we need change? And not surprising, but the answers were strictly similar. So decriminalisation, stigma, unstable funding, and the lack of meaningful community participation. This is exactly what the people from all those countries you see on slides say to us. And after that, we brought everyone together in Amsterdam and for 2-day meetings. So altogether, 24 experts from all four networks, including community representatives. So they came together and we turned those findings into a shared European advocacy roadmap. And the results became, this is our joint advocacy strategy called United for Change. And this strategy defined four common priorities for the next 5 years until 2028. So they are: increase political will and financial sustainability, promote community-driven harm reduction tailored to diverse needs, ensure access to specific health services for people who use drugs, and ensure universal access to comprehensive health and social care. And today's webinar focuses on priority 2, community involvement, the idea that people who use drugs must be part of the design, delivery, governance of harm reduction systems. So to turn these priorities into concrete advocacy, each partner network developed a thematic policy briefs. So EuroNPUD led on community involvement, the one we launched today. DPNC focused on decriminalisation and enabling legal environment. Correlation worked on sustainability and funding models, and our organization EHRA worked on universal health coverage for people who use drugs. So these briefs are practical advocacy tools. They are concise, evidence-based, and aligned with the EU and WHO frameworks. And this is very important to right now to use them and to utilize them. They are designed to be used in meetings with the ministries, parliaments, donors, helping community exactly speak policy language and back their demands with a solid evidence. They can also be adapted for local advocacy. For example, we already used it on OIT continuity in Moldova, community funding in Skopje, or it can be used for migrant access to care in Berlin. Together, those four policy briefs form one coherent European advocacy package and collective voice of our community networks. And Also, I wanted to mention that to bring these ideas shared with in our advocacy strategy, we also supported 6 small national advocacy projects in Spain, in Germany, in Portugal, Romania, North Macedonia, and Lithuania. And today, I think we will hear more from first-hand perspective about results and those advocacy pathway. So, but each focuses on these small grants. Each focuses on different dimension of harm reduction advocacy, uh, women's empowerment, migrant health, financial sustainability, or youth leadership, like in Lithuania. And with I wanted to say that even with the modest grant, modest, like tiny money, these initiatives show that when communities have support and mentorship, so we also provided a mentorship for each grantees, they can achieve real policy impact. Uh, just to summarize, what we discussed today is about community involvement. This is not just a concept. It is the outcome of collaborative process, including collaboration between our regional networks. And I think the Boost gave us this platform, and the network gave us this evidence. So with these policy briefs, these advocacy priorities are all based on the evidence provided by people from countries. And now the policy briefs give us the tools to advocate more effectively. So with this, I'm finishing my intervention. And thank you very much for inviting me for this very important webinar. I'm happy to answer any questions there.
Thank you, Igor, for your powerful and clear presentation and important work of your organization. It's really important. And about questions, we will have separate time after all speakers in the end of our meeting. So if you have questions, please don't forget it, and you can ask it after all the presentation. Thank
people
you.
Also, I think
more
people
time.
can write in the chat their questions. So we are.
Yeah. Also, and we can return to these questions.
Okay, thank you.
Thank you. And next, we'll move to the main highlight, the presentation of the policy brief. Please welcome Lígia from EuroNPUD, who will talk us through the key findings and recommendations. Lígia, please go ahead. Floor is yours.
Thank you, Vielta. I'm very pleased to be here with you, and thanks for joining. I want to start this presentation of the policy brief with the image from our title, where there is fruit, there is seed. And what does it mean? That within every success, every positive outcome lies the potential for more growth. In the context of harm reduction, the fruit is the life saved, the infection prevented, and every person treated with dignity. The seed is the community knowledge and lived experience that made that success possible. If we want to scale up the fruit, we must nurture the seed. And to ensure its message reaches the communities and policymakers, we need it most. I'm proud to announce and share with you already in the chat that this brief is available in Estonian, in French, and Italian, and in Czech. And for us, this is a vital step for the local implementation and for the local knowledge. Let me now explain why this document is important. Our core argument is that of this brief is that harm reduction, so that it is truly integrated, responsive, sustainable, and equitable too, We must fundamentally shift how we involve community of people who use drugs. To break down all the title, let's begin for the integrated harm reduction. Services cannot work in silos, cannot be closed. They must be woven into the fabric of public health, social services, and community support. And who knows the gaps in that fabric better than anyone? People from the community. We know where to find people who are falling through the cracks. We can bridge the gap between a drop-in and a back alley, making services truly accessible and integrated into the real lives of people. A responsive harm reduction knows that a one-size-fits-all model fails every time, needs to change rapidly. New substances emerge, patterns of use shift, laws are amended. The community is the early warning system. We are the first to see these changes. By involving us, our services can adapt in real time, responding not in a 5-year plan, but to today's crisis and opportunities. What about the sustainable harm reduction? Too many programs bloom and then wither when external funding dries up, because they aren't rooted in the community. Sustainability isn't just about money, it's about ownership, trust, and local capacity. When you train and employ peers, when you value local expertise, you build a system that can survive and thrive long after the initial project ends. It is planting a tree to bear fruits 2 years to come. Which brings me to the most critical principle in this brief, one I want you all to remember. Harm reduction begins and ends in the community of people who use drugs. What does this mean? It begins in the community because that is where the trust is built. And before a service of outreach worker arrives, before a doctor is consulted, there is a peer, a person with lived experience who offers a clean syringe, who teaches how to reverse an overdose with naloxone, who listens without judgment. This is the first and often most life-saving point of contact, and it is the genesis of all harm reduction. It also ends in the community because long-term health and stability are not achieved in a single clinic visit. Safety and dignity are lived daily within a person's social environment. The community provides the ongoing support, the accountability, the shared understanding, and the hope that sustains a person through their journey. When we ignore this principle, we see well-funded programs with low engagement. For instance, we see sterile clinics with empty chairs. We see policies that look good on paper but fail on the ground. When we embrace it, when we meaningfully involve the community, not as beneficiaries, but as partners, designers, and leaders, then you see something happening. We see needles exchanges that people actually use, DCRs that people actually use, peer navigators that guide others into treatment. We see the reduction in overdoses and the spread of HIV, hepatitis C, and TB. The community is not nice to have, it is essential, it is non-negotiable of dynamic of effective harm reduction. What do we call for? Our call to action of this policy brief. It's a call to move from token involvement to genuine empowerment. It means funding peer-led organizations directly, including people with lived and living experience at every decision-making table, paying for them for their expertise as any other consultant, and trusting us to lead the programs that are designed for us. I have already shared with you in the chat the several translated versions that are available. They are tools to local advocates to walk into their health ministries and their drug organisms to demand this change on our own language. The fruit of harm reduction, it is visible, the lives that are reclaimed, the diseases that are prevented, the well-being and self-determination of people who use drugs. If we want to scale up this success, we must stop just harvesting the fruit and start investing in the seed, the wisdom, the courage, and the power of the community. One only peer will not make the change. We must give the community-led organizations the leading role that we are already showing that we are capable, and we have already some successes to show. Thank you.
Thank you so much, Lígia, for this presentation, and thank you for this important work of EuroNPUD. And I think it's really important that you can share this for simple words and clear vision and clear goal, because for me it's really logical and simple, and I'm sure that all other participants can see this approach. Thank you so much. And after that, we'll hear from our inspiring organizations leading the way in practice. And I want to introduce Karim Touzani from Mantes la Gallette from France on self-organization among people who use drugs. So please, Karim, go ahead. Floor is yours. You have 10 minutes.
Hi. Thank you for this invitation. Everybody can see the slides?
Yeah, but not full size. Yeah, and now it is full size.
Yes, it's okay. Okay. First of
Karim,
all,
can you please speak up a little bit?
oh, sorry. First of all, I would like to apologize for my lack of spontaneity, but given my very poor ability to express myself in English, I will have to read the following presentation. Mantes la Gallette is a local grassroots group of people who smoke stimulants, mainly crack cocaine. To explain our name, Mantes la Jolie is a small town 60 kilometers from Paris, 40 miles average, with a population of 40,000. Gallette in slang means crack rock. Mantes la Gallette is a very young group that began meeting in September 2024. The main topic was the police talk about crack, doctors talk about crack, but no one ever asks crack users about crack. We started with 5 members, but over time the group has grown, and today there are 30 of us, including about 15 who attend the twice monthly meetings regularly. Of the 30 members, some have jobs and homes, and there are even harm reduction workers. But the majority are homeless and unemployed, and have suffered several prison sentences. We started sharing your consumption habits and relationships with products, and giving each other advice about supplies, about cooking crack, or simply how to maximize pleasure. Subsequently, the discussion took a more political turn. Stigmatization of drug users, over-stigmatization of women who use crack, racism, police violence, the fight for housing, problematic relationships with healthcare centers and OAT center, the link between abuse in psychiatric institutions and abuse in addiction treatment centers, the persecution of the poor, which affects a large number of our members. Last December, we were invited to participate in a national meeting on overdoses, where we argued that the stigmatization of drug users increases the risk of overdose. It was our first public appearance. Our first victory was being able to demand a salary for the member acting as an expert. In May, we participated in the national meetings of the Fédération Addiction Federation in France, and presented our association. We were the only voice in this debate advocating freedom of consumption and not necessarily focusing on abstinence, but rather on drug policy reform. In June, we participated as drug users in the International Symposium on DCR in Strasbourg, where we meet Lígia. In October, we were invited to participate in a symposium on drug checking. We have also integrated national working group focusing on overdoses, cocaine, and the participation of peers. We want to be everywhere because we believe that what is done for us without us is done against us. We want to be, despite all this participation, we feel like we are invited, sometimes even listened to, but also seen as subject of study. Certainly interesting, but disturbing, frightening, and treated with condescension or even pity too often. Obviously, not by everyone, but by part of the audience. In November, we will organize a meeting with researchers from British Columbia, Canada, and France. We want to participate in a revolution in community-based research in France. We want to be heard for our expertise and no longer read the book of our lives written by others. We want to be able to talk about the issues related to our consumption, but also highlight the benefits of that consumption. We are sick of participating in research that serves researchers more than us, and being rewarded with meal tickets. Stop tokenism. Our time is just as important as that of researchers and other professionals, and we deserve decent remuneration. It has been proven time and again that we are useful and relevant when it comes to reaching or influencing the practices of our peers. We are an advantage when it comes to hiring us in harm reduction services, and we deserve equivalent pay. These services would also benefit for having community members on their executive committees and boards. We are ready to be trained. We are not circus anymore. We are responsible citizens. We think and want to participate in changing drug policies. Sorry for the accent. Similarly, we believe it is essential that we are consulted in the implementation process and that we evaluated the services provided for us. We are the ones most concerned, the experts in our lives and our community. And to do without us is once again to put in place services that we will have to endure. As a local association, we are trying to engage with local authorities to find solutions other than police violence or prison sentences as a response to poverty. Housing is one of the solutions being considered. Can pragmatism be a response to increasingly reactionary policies? We will see in the coming months. Nothing about us without us. Sorry for the accent.
No, you don't need to apologize. Thank you so much for your powerful presentation and for your powerful work in these short terms and so fast growing. I think it's really amazing, and thank you for the motivated and inspiring us. Thank you so much for sharing. And yeah, Karim.
Yeah, I'm looking for how to erase a screen. Okay. No, okay. I don't know.
Yeah,
You stop sharing, Karim.
yeah,
Yes, I should. Okay, stop. Okay, stop sharing.
it is the same button when you start to share, so you need to stop the same way.
Yes, I'm looking for. Okay, okay,
yeah,
it's up.
yeah, it's done.
Good for you, Karim.
Okay,
Thank
thanks. Sorry.
It's okay, Karim. Thank you so much one more time. And we have our second speaker. She's Zuzana Nott, and we have no her in person format, but we have video. Yeah, she's from Unie LZZ. It is Czech Republic on harm reduction service provision. Can we see the video from Zuzana?
I will share the video.
Thank you, Lígia.
Hello everyone, my name is Zuzana Nott and I'm the board member of Unie LZZ, which is the Czech activist project. It's Union of People with Experience with Addiction. I'm very sorry I can't be with you live or in person, so I decided at least to create a little video of like recapitulation of our activities and successes this last year. We were very busy, we did many things, but I will just pick the most important ones. They are mainly to do with our involvement in the Czech Government Council for Addiction Policy Coordination. So where we sit and we are basically we represent people with experience with addiction, and this means basically that we are part of the discussion and part of the decision making also in draft policies. So that's quite a big deal for us. How it looked concretely, for example, this past year, 2025, there was one success we were very proud of, and it was in spring 2025, where we were part of this very important document that was drafted by the Czech addictology branch, which basically in Czech we have this one science branch, which is called addictology. It's a science about addictions, very well respected in Czech Republic, and they were drafting this emancipation document, which later was approved by the Czech government about recommended clinical approaches. And we were asked to join the document, and we basically created the last chapter of it, where it's stated and recommended that it's recommended to involve people with experience into various fields of care for people, for drug users and people with addictions. So this is a huge success because it can't go any higher. So basically now this document will be available, or is available, to all the institutions, all the experts, everyone who's interested in that. And it's stated black on white that involving people with experience is recommended in various treatments or care, including harm reduction services. So that was one success. The other one was a success that we are also proud of. There was during this year there was a little glitch in subsidies for one of the opiate treatment substitution medicine. basically the subsidies were taken away, which created this crazy situation. And us, plus together with some other council members, we basically created an appeal, a pressure for the Czech Health Ministry. We stated all the risks of that come with the current situation, with the new synthetic opioids coming to Czech Republic. We stated all the risks about overdose, and we stated how important it is for certain people who are dependent on opioids to use their medicine, which they are used to, which is either free or very cheap, and which is safe, rather than to go and find alternatives in the black market. So the appeal was received, and the subsidies were returned. So that was also a great outcome. Another thing that's happening currently right now, and it will be happening, will be important for the next year, 2026, is that in Czech there will be a new law that comes in effect in January, which is the new law on psychomodulatory substances. So we basically created a new name, a new family of substances that are not psychoactive, meaning they are not prohibited by the EU laws, and they pose certain risk, but they are not as dangerous. So instead of prohibiting them, we can regulate them. And although the law was designed for several substances, unfortunately, some of them made it by then already on the list of the prohibited substances by EU. So basically, now there is one substance that's left, that's kratom. So this law is now coming in effect about kratom, which is very popular here in Czech Republic, but it's not regulated at all, which means that, like, if you buy kratom, you can buy a very dangerous product with like all the toxins, and because it's not checked. Also, it means that any child can buy it in the vending machine without knowing the risks, so it's very messy. So now the law will ensure that the product will be only possible to be bought by responsible adults, in special shops, from special vendors that will be checked. They will have to have a license. So the product will be clean and safe. There will be all the risks will be stated. Kids will not be allowed to buy. And also we are hoping that we can use the tax. So like by legalizing the product, we can use the tax and use it for people in need. For example, people who use in a risky way and they need some treatment or they need some help. So to return it back to those who need it. How it's also important for us concretely is that we are becoming members of external scientific board of this scientific council of this Institute for European Legislation. So basically we will be, it's a board of various experts, and we will be drafting our recommendations. We will be between the wider public and the institutions. We will be connecting various experts. We can be monitoring the situations. We can be working on some campaigns, education. We can be checking the legal situation in Czech Republic and in Europe. So Union, as I said, is part of this scientific board. So this is also very exciting. We have the first meeting this week, so we will see how that goes. But basically that will be more work for next year. And we're also hoping that this new law will be successful and will be also inspirational, maybe like a blueprint for other substances that we can start regulating instead of prohibiting. And one last thing that we are super proud of is also that our union started creating our own recovery coaching trainings. So in Czech, recovery coaching is maybe a little bit more liberal and not the same meaning like in the UK. So recovery coaches here are actually used in several, like, or all kinds of fields. Some of them work in institutions, and some of them are oriented on clients who want to abstain fully. But many of them are involved in harm reduction services, and many of them work as freelancers, like me, for example. And they also work with all kinds of users, active users, past users, on basically helping people have a better quality of their lives, and helping the system. So this is also huge, and we also are super proud because it makes sense for us that the recovery coaches here will be trained by us, by people with experience who know what we need. So we have now our first pilot training. It's going really well. It's several weekends. We have a quite full bunch of attendees, and we will see how we can learn from this and how we can participate in helping the system, how we can participate in alleviating the burden and use our experience to help. Okay, so it's already 9 minutes, so I will leave it here. Thank you so much for your attention, and I wish you all the best to all the countries you're looking from. Bye.
Thank you, Lígia, for sharing, and it was really interesting experience and interesting topic. So thank you for Zuzana. And after that, we can go forward to Linas Tamosaitis. Sorry, maybe it's not correct spelling. From Young Wave, Lithuania, on community-led advocacy for decriminalisation. Linas, please go ahead. Floor is yours.
Okay, hi everyone. Can you hear me all fine? Just a quick yes, no?
Yeah.
Okay. So this is a long story, and it involves a previous project that we had around the time I first joined the organization, which is maybe like 3 or 4 years ago. And it was also related to decrim. This was during a period where in Lithuania, it was actually on the table because we had a new party come in with the promise to bring it back into the political agenda. And, it went through the motions. So I thought, okay, now is the time to go all in and, lobby from the community and social media perspective. And looking back on it, our policy was very sort of, pathos focused. It was kind of like, people's stories and, just kind of signifying or maybe emphasizing the humane angle or like the human rights angle on decrim. And it was also a project funded effort. It was fairly successful. I think we had like a social media reach of around 200,000 for like our campaign. We were featured in media, etc., etc. So I think we fulfilled all of our goals there. And when we had the opportunity to apply for boost funding, it was kind of like, okay, how do we build upon that initial goal as a peer-led drug harm reduction NGO? So me and other Linas sat down and we thought, okay, so we had a case that was primarily built on, emotional argumentation, and we thought, okay, the government now is not in a position to really approach this topic again, and now there's sort of like a dead time period before it gets picked up again, because no one's going to resume the project next year. It's going to be dead in the water from a political perspective. And the government now is pretty much non-functioning because of infighting between different parties. So no one's going to really approach this kind of radical topic when they can't even agree on who gets to be like cabinet member for Ministry of Culture. So we thought, okay, then someone needs to keep the conversation going, right? And thought, okay, we're not going to focus on the previous approach anymore. What we could use is probably more data-centric arguments or more proper assessments of what the situation is like. So we wanted to kind of have a foundation for how to better argument in the future when there's another window of policy change, and also to keep tabs on what is going on in Europe. So the deliverables of this project were threefold. First of all, we wanted to do a survey. We wanted to just pretty much analyze the opinions of young people around the country. And within the omnibus survey, there was around 1,000 people. So 1,000 people is was like minimum sample size to have a representative study. And we actually managed to find an organization that did that in a cost-effective manner to fit within the funding of the project. So that was wonderful. And pretty much we just kind of asked attitudes to people, decriminalization. What do you feel about, existing government policies? Are they helping? Are they harming? Are they efficient? Are they not efficient? Are people aware of what the situation is? And not surprisingly, I think across the board, just people weren't really familiar with the situation. Decrim is still controversial, so it's not like sweeping across the board. But there is a clear consensus, regardless amongst whether it's rural or urban or education, not education. People think that there is a lack of evidence-based or education-based approaches currently, and people just do not have the necessary tools or information to be dealing with the drug situation as it is currently in the country. Second and third points were we wanted to bring in more examples from other policies in Europe of who had dealt with decriminalization or who was currently kind of dealing with the process. And we thought pretty much the most relevant example still for us will be Germany, because the situation about cannabis legalization in Germany has the potential to reshape a lot of political narrative, and also just in general, from like a geopolitical perspective, Germany is close enough that it's kind of relevant that what happens in Germany starts affecting Lithuania. So I managed to get a good speaker who was kind of part of policy formation within the decriminalization project, and we hosted a discussion in Lukiškės prison, which has now turned into a sort of like cultural space. So I mean, it was pretty successful for us and pretty informative, because I suppose Lithuania has a fairly similar problem in the sense that they had to pass this in. It wasn't a particularly liberal parliament. There was like a significant conservative presence, and overall the messaging and the experience was how to get conservatives on board and how to get everybody at the table in order to pass legislation, which is kind of refreshing to see in a geopolitical climate that is very polarizing and very, should I put this, yes-no between the political left and political right. So I think there was a fair bit of insight of what things we should adapt from that policy messaging going forward into future decriminalization campaign efforts. And the third goal was to basically just get more professional opinions from other people, politicians, policymakers, etc., about what happened the first time, why it didn't work, what can be done, and what, as I said, building upon previous successes in other countries. So I think everything went fine, and those three deliverables were accomplished, and we have the information at our disposal. The question is where the country is going to be in terms of when the next overtone window for a policy shift, because it seems like that the previous projects were completely scrapped. But in the context in general, when I would compare the overall year, with the global draft of funding and the collapse of USAID, it's been very refreshing to find that some avenues of funding are still available, and they're funding critical projects and kind of development of foundational knowledge building for NGOs and organizations such as ours. So we've been very appreciative, and we hope that from the perspective of Boost, who have been kind of closely involved in the overall project, that they're happy with the results as well. So I don't know. It's gonna be a bit maybe shorter on the time than I was allotted, but I don't think anyone's gonna be against because we're running over a bit.
Okay. Yeah, Lígia?
I think Linas made a question. I'm not sure, but well, we can go back there after the next speaker, maybe.
Sure.
Yeah. Thank you. We will have time for questions after our next speaker. And thank you, Linas, for your presentation and for your amazing work about community-led advocacy. It's really important to see these best lessons for other countries. And our next speaker, he's Jose Queiroz, if it is correctly, from Portugal, from APDES, and he will say about peer integration in harm reduction teams. So please, Jose, go ahead. Floor is yours.
Hi, hi, good afternoon. Thank you very much for your presentation. So can I share my PowerPoint presentation? I think it's easier to, okay. Can you see it?
Yeah, but not full size screen.
But now you can see it.
Yeah.
Okay, thank you. I'm going to be very brief, like, trying to keep the 10 minutes. Thank you very much for, for inviting me to present some work that we have been doing since the last more than between 17, 18 years on peers, and from a perspective of participation and social transformation. So, sorry, oops, it's not working. I don't know why. It's working now. So I have divided, our work with peers, following several projects in three perspectives. So the integration of peers in services, the action, a perspective more dedicated to the idea of action research, and the third one, with the pillar of empowerment and advocacy. So with this idea of peer integration services, that we see it as trying to integrate people with lived experience as peers in intervention and outreach teams. In the action research, it's more focused on the production of applied knowledge, pilot texts, and especially participatory methodologies. And regarding empowerment and advocacy, so the idea, of these projects that we have developed in APDES is, it's more about reinforcing citizenship, public visibility, and the rights of the community in general. So the community here, we are talking about people living in homeless conditions, people using drugs, sex workers, and so on. So, for example, in this action research / peer integration category, we have this one is one of the last ones, peer-to-peer. So the idea was, focus more on drug context and peer work methodologies. The objective, as we are, writing here, it was to empower some European NGOs, in particular from Poland, Lithuania, and Greece, with this, peer work methodology, to promote on these organizations or on their communities the importance of the recognition of the role of peers from a point of view of the organization, of the professionals, or even the board of directors. And the results of this kind of project was, the training materials that we have produced at European level, international meetings, and an ebook of good practices. INPUD is one of the most, oldest projects that we have. It was done in Portugal, mainly in Portugal. It was not an European one, and it was, done with some NGOs from the central and north part of Portugal. The idea of this, project, the idea and strategy at the same time was to put work first instead of abstinence first. So the idea was that, with work, we can promote a serious integration of people using drugs in society, in their own communities, and especially in the NGOs that work on this field. We have produced a working first manual, and with a replicable integration model that some other organizations in Portugal, for example, are still using. So this one, it was, once again, on action research and peer integration. It was combining both of them. Vipers, it was, the last one. We have finished this one. It was an Erasmus Plus project. We have finished 2 weeks ago, or last week, I think. And as you can see, we have only 2 main partners working with us. It was Ksher from Lisbon and Medicineras from Barcelona. It was a pure, let's say, peer integration project, but dedicated to produce information and a toolkit that could, be delivered to communities and organizations in form of training. And again, the idea was, to put the focus on social and professional inclusion. Then, dedicated to another part of the communities, like the sex workers, we have, being funded by Open Society Foundations in 2015, if I'm, 15, 16. And the idea was, to apply to focus on the rights of people doing sex work. And we have done, among other things, produced advocacy guides with these people that do sex work. We have produced these advocacy guides. We have translated to several languages at European level, and we try to promote the community empowerment. Some of the results is, this smart guide for sex workers, public events, and training for, main agents in this area. Finally, another one this one, it was from the REC program, the Rights, Equality and Citizenship Program of European Union. Again, this was, dedicated to sex works, but to a particular subgroup, the transgender sex workers. And the objective was, to focus on access to health, legal and social support, and trying to combat, discrimination. Again, this was, on the empowerment and advocacy. And the conclusions that I want, to put here on the table of these several projects, they are always, going towards the same set of outputs. One of them, it's these projects, among others, that European NGOs, European organization of peers are demonstrating is the crucial role of peers as trust-building mediators and agents of social transformation. That's for us the trust-building mediators, and the idea of being a social agent of transformation. For me, it's quite important. The other one, is that we need to give a unique place to the life experience of people that use drugs, that do sex work, and so on, because this lived experience should create unique bridge between services and the people living in vulnerable conditions. The other one, it's always important to reinforce the effectiveness of the teams that work, the teams of professionals and peers that work with communities. And the other one is that we reinforce with peers the quality of the service, the effectiveness of the services of these organizations. And mostly important, it creates the conditions for the dignity, recognition, and the active participation of the peers and the communities where they are coming from. And finally, the idea of reinforcing, valuing the role of peers as a fundamental path to a fair, more effective and humanized intervention. Another thing that I would like to add to this conclusions is the idea of democracy. With peers, we promote a more democratic, a more fair intervention, a more democratic and context in the cultural, organizational environment. What I mean with that is when you put peers inside NGOs, there is a tendency to share knowledge, to share responsibilities, meaning that to share power among professionals and among peers, among professionals, peers, and communities. And this idea of sharing power, this idea of, of working towards a more democratic organization for us is very, very important. And that's it. Thank you very much.
Thank you. Thank you so very much for this presentation and for these really powerful messages about a democratic approach. And really, for me, peer-to-peer, it is most effective approach. And thank you for sharing of these materials and your experience. Thank you. Okay, and now we'll open the floor for questions and reflections. Please use the chat or raise your hands if you'd like to speak. For now, I haven't seen any questions, so you can put it in chat. And I kindly ask everyone to be brief and respectful so that more voices can be heard, because we have not so much of time for our webinar. So please go ahead. And I think, Linas, you have some question? Yeah?
No, it wasn't a question. I was just asking people whether they have any questions. That was it.
Okay. Okay, yeah. So go ahead. If you have any questions or reflections or comments, please.
Can I say something?
Sergio, please.
Yeah. Hello. I'm Sergio Rodrigues from Porto, Portugal. I'm peer and activist. I want to only say that the most important that I see in our country today is the recognized peer as a professional, as a profession. Because, for example, I try to find a work and it's difficult because the profession of peer don't exist. And for me, the most important is that we must make a lobbying or something to push our government to recognize peer work as a profession. It's only share this. Thank you.
Thank you, Sergio, for your reflection. Maybe, Jose, you have some comment about this point, about this lobbying of official professional peer.
You were addressing the question to me? Or yes, I have a comment. Yes, thank you very much.
Thank you.
Well, Sergio, he was a peer of our organization for several years. I think he was one of the first peers being paid in Portugal, working in drug context in outreach teams. And I totally right. I totally agree with Sergio when he's saying that this professional, this institutional recognition is not yet on the table. So there is some movements from some government officials saying that we need, to reinforce this status, that we need to put that on law, so that, and that we need to oblige somehow the teams of professionals to put, to integrate peers as workers, with a status and with a salary on the harm reduction services, but still is not there. Still, so there are good wills. Let's say there are nice words, but it's nothing, firm. There is nothing written down. And I agree with Sergio. We need really to continue to fight for that, because I totally agree with this idea of, of the official recognition with an official salary paid, every month, and as everyone should be paid, when they are working on this field.
Thank you, Jose. Thank you so much, Sergio. It's really important topic, and in Ukraine we also think about this because it's also about our human rights as employers, as peers. Yeah, so it's really important. And we have our next hand from Magda, and then Igor. Magda, please go ahead. Magda, we can't hear you.
Your micro, yeah.
Sorry. Sergio. I actually subscribe to what Sergio said. We don't have that definition. I work in GAD since 2014 as a paid peer. Actually, I would like also, Sergio already pointed to the facts of our profession not being recognized, even though we do a very important job, and we have a short salary for the thing that we do among our communities. We are the bridge of the street for people that are hard to reach to the services. And also, nowadays, I think we should be more aware that peers need also support, peer support among peers, because the mental health is an issue. The drugs are very adulterated, and
Sorry, Magda, I can listen you.
Yeah, the voice.
We can listen you.
You can't listen.
Do you have any problem with mic?
I'm gonna take the image so you can listen better. Do you listen better? Without
Yeah, now it's better. Thank you.
Without the image. So what I would like
sorry, Magda. I hear that you said about also mental health issues. Maybe you can put this comment in the chat, because I think it's really important issue about mental health. Please, because we have some technical issues as to hear you clear. Sorry.
And peer support. Yes.
Please put it in the chat if you can.
Okay.
Thank you so much. Okay, and our next hand is from Igor. Igor, please go ahead.
Yeah, I just wanted also to react to what Sergio said, because I'm originally from Estonia, and I know it's a long time advocacy in Estonia to include peer work as paid professional workers. And I know in Estonia they took example from mental health, from mental health sphere. So there are already institutionalized peer workers in mental health, and so they took as an example and tried to pilot this model for harm reduction, involvement of peers into harm reduction. And right now, and also they collaborated with universities to form a minimum program for training program for peers. What I want to say, so there are, I think we should look into the other spheres. Maybe those peers already institutionalized in other topics like mental health or other directions, and took their examples and maybe to collaborate with them in order to move this topic. But also I wanted to share that we, together with EuroNPUD, we right now developed a new project proposal for access to migrants, people who use drugs in European countries. And we also want, one of the topic is to promote peer involvement and mediators between migrants who need services and existing services in countries, and to try them to institutionalize on the local and municipal level to ensure that they are paid and they recognized as real professionals. Thank you.
Thank you so much for sharing, Igor, and about your plans, and also about your thought about maybe we can collaborate with other similar initiatives. Thank you. I think it can really work good, because partnership is good in all times. Okay, and we have our next hand from Lígia, and also after this, I want to read some comments in the chat after Lígia's speaking. Lígia, please go ahead.
Thank you, Vielta. So what I wanted to say is that I've been feeling, and that's what one part of what we try to put in the policy brief, that when a peer starts works in a team, usually it won't develop so much if the peer won't have other spaces of socialization, let's say, with other peers. So we believe that it is important not only to scale up the peer work in harm reduction teams, but also invest in spaces of socialization of people who use drugs as groups of mutual help, as organizations led by other people. We had Karim bringing us Mantes la Gallette, his example. And also, for instance, EuroNPUD as a space of socialization for people in Europe that use drugs and that work in harm reduction. So that's it. I wanted to highlight this because I feel that many times peers get isolated in their teams, and they need this, they also need this part so that they are empowered and they can build community, and we can build community with each other. That's it.
Thank you. It's really powerful message. Thank you, Lígia, so much. And we have some comments in our chat box. From Igor, thank you for organizing this event, and also from Joanna, mental health issues, that's what Magda is focusing on, and outreach work from peers in street settings. And also from Joanna, it's not only employing peers, but have a strong team that's open space for equal colleagues treatment, having in mind that can be stricken sometimes using drugs and working 9 a.m. to 5 p.m., flexibility in times, pay political participations apart from salary, and time to address peer work in organizations. And also Magda said that we need responses about supporting peer-to-peer and mental health. We navigate through two different worlds, the average and the marginal. It's a balance, not always not to do. And Joanna says that apart from that, harm reduction is grassroots, so drug users organized should have space, foster and help it by NGO at the beginning. And Karim says, what is peer? In France, we have peer workers, but to be peer worker, you need more years of study than social worker. Or you have to come from Narcotic Anonymous or Alcoholic Anonymous. Difficult for grassroots activists to be a peer worker with a salary. Yeah, cool. And Sergio share with us why peer work is critical in harm reduction. Lived experience. Peers bring first-hand knowledge of substance use, stigma, and survival strategies, making interventions more empathetic and effective. Trust building. People who use drugs often trust peers more than traditional professionals, which improves outreach and engagement. Cultural relevance. Peers understand the community's language, norms, and needs, helping tailor services appropriately. Advocacy and empowerment. Peer workers often become powerful advocates for policy change and community mobilizations. Yeah, and this is more. So I think you can just write, because it says separate policy brief looks. Yeah, and Magda also shared that peer works PhD is experience. Yeah, sure. And I have my also hand up because I also have a comment. I think also important point is it's when we are in my community in Ukraine, and we have organization, it is community-based and community-led organization in Ukraine. So all of our staff and workers are with a lived experience, and we need also care of each other. Because it's also important because we have more risks of health issues, of mental issues, physical health issues from other people without experience of drug using. So, for example, we built in Kiev a drop-in center, community center with integrated approach. And also we have separate room for staff of peers, and we have possibility to cook some meal and have some tea and have some comfortable in dark light place because we need to rest, and it's also important. And also we have some events together, not for work, but just for rest, for speaking. And it's because I think it's more difficult to find resources on this because it's not about harm reduction services for people who use drugs. It's about support of this team of peers. But I think it's also critical important because, for example, when you have a flight and you have some emergency situation, you need to put the mask on yourself first and then on children or other people. And I think here we also need to take this approach, care of ourselves. Because in Ukraine we have crisis situation now, and we see this really clear because many health and mental issues they increases when crisis, and we need these resources to support other men and women from our communities. So we need to support ourselves also. Yeah, it was my point about the topic. And also, I think also we need to organize some comfortable conditions to increase skills and knowledges of peers about higher education, for example, and also ask what they want, because in our organization, I ask my girls in the staff what they want. Maybe they want to be trainers in future, or scientists, or psychologists, or other. So I think we need to learn to dream, because I didn't know how it is to dream about my future, and I needed to teach to do this. So I think we need to think about this, how we can grow our peers, because they are our main tools to change this society stigma and discrimination, and it's also important. Peer high degree, it is it sounds really great. Thank you, Alexei. Thank you so much. Maybe you have more questions or suggestions or comments. So please, we have some time for this, and I don't see hands. I see. Matt, please go ahead. Floor is yours.
Hey everyone, thank you for a really great webinar. It's really nice to see you all moving forward so effectively. And it's also great to see this cross-network collaboration, which I think really reflects meaningful participation with people who use drugs. About 4 or 5 weeks ago, I had the pleasure of visiting a new initiative in Norway called How's It Bergen, which COACT is now going to write a technical case study about. And this is now leading to, it's basically, the project is called The House, and the name goes with different cities. They have new projects now launching in Oslo, and already one in Oslo, and another city is also launching an initiative. This really marks people who use drugs taking over the front end, the low threshold end of drug services, working alongside outreach workers, working alongside drug consumption rooms, working alongside heroin-assisted treatment, but having a space where drug users can go and be together, can relax, can do projects, can eat food, can provide life support to each other, can help each other access dental care, be effective parents, all of this type of work. So just to really, I think we have such remarkable practice coming out from on the ground, and I really want to commend our peers in Norway for setting such a positive example, which we're really looking forward to writing up.
Thank you. Thank you so much, Matt, for your amazing remarks. Yeah, it's really important. Yeah, okay. I don't see other hands, so I think we can go to our finishing of our meeting to close. And as we wrap up, I'd like to thank all of our speakers, partners, and participants. And this policy brief, it is not the final word. It's a starting point to action, I think, for all of us. And I think this webinar is clear, this call is clear: fund, formalize, and follow the lead of communities. And if you haven't already, you can download the policy brief from the EuroNPUD website. Lígia shared the links here in the chat box. Use it in your advocacy, in your work, and in your conversation with policymakers and donors also, to make more visible this important document. And thank you all again, and I hope see you soon, and we'll be in touch.
Thank you, everyone.
Thank you. Bye.
Bye-bye.
Thank you.